Hello. Welcome to our monthly webinar. This webinar is brought to you by the following collaboration of sponsors. As always, we thank Care Choices Hospice and Palliative Services, O'Connor Mortuary, Caring Companions at Home, and Alzheimer's Orange County. And I'm Kim Bailey, and I'm with Alzheimer's Orange County, and I'll be your host today. So our topic is Sundowning Syndrome in persons with dementia. And we have brought back a very popular presenter. By popular demand, we'll have Erin Light from Silverado Senior Living. She is Erin Light, the Senior Administrator at Silverado Senior Living in San Capistrano. She's a gerontologist with 10 years of experience, specializing in dementia care and supporting the needs of older individuals. She received her bachelor's in cognitive science from UC San Diego, after which she worked in dementia research in a joint UCSD Veterans Hospital venture researching mild cognitive impairment in older veterans. Erin obtained her master's degree in gerontology from USC and became the graduate researcher on a joint Silverado Senior Living and USC study exploring the effects of daylight in reducing depression in memory-impaired adults. Erin also holds a residential care for the elderly administrator certification and a dementia care specialist certification. She is also an active member of Vance Caesar's Leadership Development Program. Erin's passion for older adults experiencing memory loss stems from supporting a grandparent with the illness in a caregiver role during her teen years. Erin has extensive experience hosting support groups for various populations, including family members of individuals with memory decline, and also participates in speaking engagements on executive functioning and cognition. Erin is the advisor to all the master's level social workers at Silverado Memory Care Communities nationwide, and she hosts a company-wide Zoom support group for the general public. So as you can tell, we are very happy that she was able to find the time to be with us today. So without further ado, let me bring Erin on to take over the presentation. Thank you, Erin.
Thank you, Kim, for having me. It's an honor to be back with Alzheimer's Orange County and to spend some time with everyone today. So nice to have you joining the webinar so we can support our seniors in whatever county you're in right now. Let's start with some of the basics here. So we are going to just briefly go over what is dementia. I'm sure many of you have already been through a lot of training and education. Dementia is an umbrella term that describes a variety of diseases and conditions that causes damage to the brain. This results in a loss of cognitive ability. This is not part of the normal aging process. And a lot of times people will come up to me and say, well, what is normal and what is unusual, right? So a normal part of the aging process would be forgetting somebody's name once in a while or having a little bit of difficulty word finding. Something that would be more concerning or might be a sign of memory impairment would be forgetting an entire person, really having trouble with word finding often, and maybe not recognizing your keys or not knowing how to get home, right? So forgetting where your keys are at is normal for all of those of you who have the same problem as me. So it's meant just slow and progressive. It starts with more mild symptoms and eventually there's a huge decline over time. And Alzheimer's disease is the most common form of dementia. So here's the umbrella that we are mentioning. There's over 120 total distinct types of dementia. So we categorize them into irreversible or reversible, right? So the most prevalent is Alzheimer's disease. So the list on the left, the second most prevalent is vascular, so strokes. Third most prevalent would be frontotemporal dementia, and then Lewy bodies and some of the other ones. So Parkinson's disease, which is very common as well. You might have heard of Huntington's disease or CTE. Also early onset dementia is most of the time irreversible. Some of the reversible types on the right side, depression, drug interactions, nutritional deficiencies, thyroid disease, infections. Some other ones could be anesthesia, right? Coming out of anesthesia, especially if you're a senior or older adult, surgeries, and even sometimes traumas such as the loss of a spouse or something that's been very traumatic in their lives. So worldwide, according to the World Health Organization, dementia is the 7th leading cause of death, right? So this is really impactful, and it's going to increase, especially as the largest generation of the baby boomers is coming into play, and we're going to see a lot more changes with that. It's really going to change the landscape of what the US and the world looks like. So speaking of changes, let's take a look at some of those that are very common and associated with Alzheimer's disease and other dementias. Loss of memory, of course, is the most popular. Language and communication changes. This often happens early on for sometimes a quarter to a third of individuals, which is somewhat alarming, right? So somebody who is physically very able and able to take care of themselves but cannot verbalize, right? That's very distressing to them and their family who's caring for them as well. Loss of executive functions, right? So not only in the FTD type of dementia, this is across the board. So reasoning, judgment, and abstract thought. It's harder for the brain to process through those. So you see a lot more of impulsive options in their lives that may not have been there before, that seem really unusual outside of their normal personality that you've known their whole lives. Of course, visual spatial perception changes, and then behavioral changes. And some of you may know one of the first parts of the brain that's affected is the hippocampus. So you might have seen this in another Alzheimer's Orange County presentation. It looks like a seahorse. That's kind of what they refer to it in the field. It just basically makes it harder to store new information. And a lot of times by the time somebody is diagnosed, the brain has been changing and compensating for a very long time, sometimes up to a couple years beforehand. And ultimately, that's why it's irreversible, is because there's already been so much damage done that's accumulated, and the brain can no longer continue on compensating for that long. So how does Alzheimer's disease affect behavior? So for Sundowning syndrome, one of the disruptive groups of symptoms normally happens in the middle and later stages of the disease process, or some other forms of dementia is sundowning. It's not necessarily a disease, it's just the group of symptoms that occur most of the time at a specific time of the day consistently among some people with diseases like Alzheimer's, other dementias, in particular vascular and mixed dementias. This might not happen for the entire span of their decline. This could be early on, it could be, most of the time it is in the middle or later as it says here, but it might be for a few months, it could be a few years. It really just depends, and unfortunately we have to be more reactive to this when it comes up, which is the stressful part for both the person and those caring for them. Okay. So Sundowning syndrome is also referred to as late day confusion. So people experiencing that state of confusion, more agitation, aggression, occurs later in the afternoon as the day progresses into the night. This is normally when we're trying to wind down, right? So sometimes if you have that little bit of it's a little confusing sometimes driving on the freeway for me in Orange County between when the sun's setting, right? So that's normal part of what we experience without any memory impairment. So even more so, this is very much amplified. Some of the causes, it's not really well known what the underlying causes of Sundowning syndrome is, but these are some of the theories. It could be an accumulation of sensory stimulation that's built up over the course of the day. This would result in higher levels of stress. It could also be a hormonal imbalance that occurs at night. This would affect the individual's ability for their natural circadian rhythm to stay on track and on target. Fatigue building up over the course of the day. It takes a lot of mental energy to process the world around us if our brain and the neurons are not connecting very well. So if you can imagine, let's say you're at a mall or somewhere where there's a large group of people, you're hearing the children, you're hearing somebody next to you, you might be hearing music that's playing over a loudspeaker. You're processing a lot at once. With dementia, your brain has a lot of trouble doing more than one thing at a time, and it's very, very exhausting and mentally taxing. Sometimes families will start to experience this. They'll see some of their loved ones get a little bit quieter during certain parts of the day, right? If there's a group of people that they're normally very social with, if it's uncomfortable for them, or if maybe it's embarrassing because they know they can't participate as well, they might kind of withdraw or be a little bit more isolating because they feel that they're not able to still play that same role that they have been for most of their lives. Also, anxiety caused by the inability to manage the dark. So changes in natural light are associated with this time of day. This can be very disorienting. And a lot of times when we think about memory loss, what also is we'll talk about is some of the behavioral changes and some of the motor. Everything in the brain affects something in the body, right? So your ability to perceive shadows, your ability for your eyes to constrict and go from inside to outside light. So everything gets slowed down over the course of memory impairment decline, and so that's what is affected overall. Okay, so now we're going to get into, let's say, the meat of the symptoms of Sundowning syndrome. So there's 3 groups that we put these into categories: mood changes, cognitive effects, and behavioral expressions. So in mood changes, we see pronounced mood swings. We see a lot of heightened emotions, perhaps crying, anxiety, agitation, sometimes even aggression, whether it's verbal or physical. We see a lot of restlessness. Also, increased fear and paranoia comes into play pretty early on most of the time. Some of the cognitive effects might see visual or auditory hallucinations, delusional thinking, disorientation, confused about the identity of people. Disorientation is a big one. So for some adults who are older, as they are diagnosed, a lot of times there's a propensity to want to go back to work, even if they're retired. So we see this a lot of times in communities, or you might be experiencing this at home where someone's trying to leave often. If it's during those sundowning hours, I try and let families know this is pretty logical. Most of us have, whether we were working or we were just out in the community, dropping kids off to school and whatnot, we're out of the house most of the week, 4 to 5 days at least of the week, and we come home relatively at a normal, consistent, habitual time around dinner. Right? So wanting to leave or come back home during that time, that's pretty logical. That's a decades-long habit that's pretty much been ingrained, right? So somebody wanting to go back to work, if that's what their brain is remembering that they've done for decades on end since they were in their, early 20s or 18 even, that's pretty common and pretty logical thinking. It's weird for us to watch that progression, of course, but they're not trying to leave you specifically. They're trying to find their routine again, right, as their brain changes and can't process what their usual routine should be. Behavioral expressions. Some of these are very sudden and difficult to explain. So this could include the inability to respond to reasoning or stubbornness, right? Processing what's happening in the world is very difficult if you cannot comprehend or you can't give back feedback to somebody who's asking you a question, right? So if we're addressing somebody who is experiencing sundowning, it's really important to try and stay calm, and we'll talk about some of those triggers and responses in a little while. Sleep disturbances is another behavioral expression, the inability to sleep at night. This can lead to delirium. So even just 2% of delirium and sleep deprivation is really difficult to overcome, right? When we're tired, Monday morning comes around and hits, just complicate that and compound that by my memory decline, right? And multiply that by years. It's going to add up, and it's very exhausting. Trouble speaking and thinking clearly, right? So it's very embarrassing if you can't answer something. We see this quite often with our residents, for example, when they go to the ER. At our community, we do try and send a leadership member or a caregiver with them, because sometimes answering questions that are rapid fire at them, like what's your middle name or what'd you have for breakfast, right? If they can't remember, they're probably going to want to leave, right? So that processing makes it very uncomfortable for those experiencing sundowning. Hiding things, right? So the older generation, especially those who have gone through the Depression era as well, that's very common that we see that. Rocking and pacing and wandering as well are some more behavioral expressions. And also another one that I've heard recently in the field is a term called shadowing. So somebody who follows maybe a caregiver or a spouse very closely around. This is a new term, and there's a Cleveland Clinic article about it. You can Google it pretty easily, but I thought that was pretty interesting. Okay, some of the risk factors for sundowning. This is huge, right? 20% of people with Alzheimer's disease experience some level of sundowning behaviors. So these risk factors are exacerbated by a history of alcohol or substance abuse, which can lead to more severe symptoms. Those changes in sleep patterns and lack of sleep, wakefulness during the night. If you're having a rough night and you're up a lot, maybe you have somebody at home trying to get ready for work at 2 o'clock in the morning and take a second shower at 3 a.m., right? It's going to be a very challenging next day because that's going to really affect them and their ability to be able to process with a very tired mind. Difficulty separating reality from dreams, right? So we try and encourage individuals who are experiencing memory decline to not watch the news so much at nighttime. Those CSI channels and shows that we love so much too. Sometimes it's difficult to parse through what's actually happening in real life and what's happening somewhere else. We had a resident who was watching some of the fires that go on in California, and they had a really difficult time understanding and comprehending that the fire wasn't here and we didn't need to leave, right? Stress, of course, caused by any unusual events. Visiting the doctor is a huge, huge trigger. A lot of individuals don't want to go, especially in the earlier stages, because they are aware that they cannot communicate as well. They might not be able to verbalize that, but they know it's going to be uncomfortable because there's somebody with experience who is going to be able to see that they're having changes that they could be feeling. Right. So I can't tell you how many times we hear from families before residents move in, oh, we haven't been able to get mom or my wife to a doctor's appointment for a year or two. They just won't go, or they left the waiting room after 5 minutes because they didn't want to stay any longer. Okay. And then lastly, the caregiver stress or frustration. Our emotions are going to play into this. Unfortunately, we get really tired and we can be burned out, but this can really influence the behavior of the person with dementia. They can absorb our emotions, right? They're going to watch our body language. If we're crossing our arms, if we're sighing, if we're kind of rolling our eyes, that's really absorbed by them, and they feel that, right? And a lot of times they can't separate their emotions from ours. Okay, so there's some prominent triggers that can aggravate sundowning behaviors. So at the environment level, low or dim lighting is really important. Like I mentioned, that depth perception, those shadows, just being able to process even what time of day it is. We have quite a few families, or when we go to do an assessment at somebody's house, a lot of times the lights are off or the lights are down. So sometimes it's a sensory overload where they think it's too much for them to see, but then it increases their fall risk, for example, right? Those increasing shadows. Noise and distractions, right? So that could be a perceived movement. It could be something outside, right? That ability to parse through background noise really goes away very quickly throughout this, throughout sundowning. Strange or unfamiliar settings or surroundings, right? New people coming into your environment, maybe a neighbor who stopped by randomly and they haven't stopped by in 2 years because of COVID, and now you've got some really new person in your house and you don't really know how to process that. So they might leave, they might go to their bedroom instead of trying to socialize, for example. Clutter is a big one. We hear this often. It causes a lot of confusion. We hear about fixations on financial paperwork, for example, a desk. The more clean you can keep their usual spaces that they inhabit, like an office or a kitchen counter, it's going to be a lot better for them. So putting things into a drawer. Sometimes they'll start to go through drawers, so maybe having things, clipped together a little bit, that can help as well. And that aggravation that comes from not being able to understand what the clutter is about or what they should do with those can cause a lot of confusion. We had a friend, and their grandpa was declining and was going through a lot of soda cans, for example. So he would forget he opened one up, would go back and get another one, and probably had 10 maybe open around the house by the end of the day, right? So all of that adds up and really affects their quality of life. Right. Winter time, of course, the shorter days with less exposure as well. So additional triggers that can aggravate sundowning behaviors at the individual level: fatigue or illness or an infection such as a urinary tract infection. Poor vision. So if they don't see that clearly, they may experience visual hallucinations. If they lose their glasses a lot, for example, or as their vision changes and they're unable to go to an eye doctor, for example, or don't know that their vision's becoming blurry, that's really going to affect it as well. New medications or changes in medications, or even meds that wear off later in the day. So sometimes if that's noticed, speaking to a physician. If you have meds that on their usual timeline of wearing out around 8 to 10 hours, if that's right during those late day sundowning hours, that might be really difficult for their body to process without as much support if they are having anxiety, for example. So that's something to talk with a physician about. Other disruptions of a person's internal clock, so lack of sleep, having the blinds closed, not having a lot of daylight, and we'll talk about daylight in a couple of slides as well. Other changes in their daily schedule or routine, right? So if showers are a great example of one. If you're the caregiver coming in and trying to help somebody who's maybe been living by themselves, if they usually shower in the PM and we only have time to give them a shower in the AM, I do not take showers well in the PM. I am sorry. I will be very cranky. I'm gonna have to dry my hair. It's a whole thing. And so that's a routine I've been doing for at least 3 odd decades, and for them sometimes 7 or 8 decades, right? So knowing their usual routine and trying to keep them on that routine is really going to be the most beneficial thing we can do to help them. Right? Something might remind the person of a time when they were younger, right? They might be expecting a spouse or a child to come home. They might be ready to cook a meal or go to work, pick up a child from school. It's those decades old habits that are very logical, and they're very imprinted in our brain. So we know that sundowning can be very detrimental and even dangerous. for our seniors. So there is that increased likelihood of injury from falling. And I always ask people to think about their fight or flight response. You know, what's yours? When you get startled, what do you do? Do you get anxious? Do you cry? Do you try and remove yourself from the situation? Right? So if somebody who's older gets startled, they might have that fight or flight response, and their body is going to try and move them quicker than they can, right? So somebody who uses a walker, and if they forget their walker and they're trying to get up out of a chair and move somewhere because they need to get out of that stressful environment, or if they're sundowning, they're at a higher risk of injury because they are more likely to be at risk of falling or tripping, for example. Wandering off and becoming lost. This is a huge one. That internal need to go, that kind of Energizer Bunny, just that drive that's very consistent. Again, it could be around the time when they used to work. We had an individual at one of our communities who always needed to go home at like 6 o'clock in the morning. They were up all night, and they, you know, we found out they were a night guard, and they had been a night guard for probably 5 or 6 decades. We got them a badge, we got them a clipboard. They were our night guard at one of our communities for Silverado, and they slept during the day, and you know, it did help, but that could have been a real danger if they had, you know, gotten out of the community. If agitated, they may remove a necessary medical device. We always hear about hearing aids being lost or glasses. There's a company, it's called Zenni. I'm sure there's other ones, but this is one that we use the most. Z as in zebra, ZENNI.com. You can go on there and put in whatever prescription you want. So I always tell families, buy 5, 6, 7, 8 pairs of glasses. I don't care if it's reading glasses or for distance or for nighttime, because they're going to move around, and that's really, really important because that is going to affect their physical ability. Falls are really going to be a detriment to somebody who's already having cognitive difficulty processing. A hit to the head, for example, is very detrimental for their brain to recover from. Additionally, increased agitation or violent behavior could result in injury to themselves or others. So that fight or flight response, right? If we're trying to get somebody to sit down for dinner and they're not sitting down, you know, taking their arm and trying to make them sit isn't going to help. You know, sometimes we can do, you know, hey, let's try sitting down. We could use visuals like patting the seat, for example, or we might say, let's sit down together in 1, 2, 3, right? So trying to make it as calm and as efficient as possible. If somebody is safe and they are having a really bad night, if they are not trying to exit seek and they're just pacing, obviously, you know, we want to be aware of their fluid intake, for example, or foods, but sometimes it's good just to let them walk it off and try not to interfere. Adding more to their situation, like asking them questions. Do you want to do this? How about this? How about we come sit on the couch? Let's do this. It's all very well intentioned, but it's very difficult for them to process, and that can just really add to it. Okay, so we're going to talk a little bit about some of the prevention for supporting those who are experiencing sundowning. So we can do quite a bit in the environment to maybe take the edge off, as we would say. So maximizing exposure to light earlier in the day to encourage nighttime sleepiness, right? So keeping that circadian rhythm going. I was a graduate researcher for a pilot program that Kim had mentioned in the bio, and there's another slide about that later. It's really interesting to see the results of how much natural light versus artificial light really affects their ability to sleep better and have a little bit less sundowning in the evening. So we'll go into that very shortly. All right, so that exposure to light, wall-mounted lights are great. Lights coming from the floor, that makes the shadows look backwards instead of from an overhead. Fluorescent lights sometimes are a little strong, so a lot of standing lamps are a little bit easier. Keeping the windows open for as long as possible and letting the daylight pass is also helpful. Just trying to keep as many lamps or lights on around the house. There's a lot of smart plugs and smart devices and smart lamps. So if you have a loved one who's actually still living at home, it's a really great idea to get their lamps or their lights on a schedule that you could use your phone to adjust, right? Or set them all to turn on at 5 o'clock when you know the sun's going to be setting, right? Because they might not forget. If you're coming into their house every night to check on them and it's always dark, that's a really great way to help support them. In the late afternoon, reducing background noise or stimulating activities, right? So again, that really, really good intentioned urge for us to care for our loved ones sometimes can be overwhelming, right? So something as simple as sitting down and, on a bench by the ocean and just listening to the waves, right? Instead of trying to do a cognitive task that's going to get them some trivia and some brain stimulation, right? This is probably not the time to do this in the afternoon. A lot of TV noise in the background could be disruptive to them. A lot of times our residents, even in our community, they try and look for quieter spaces in the community. That could be a room, maybe that's not being used, or it could just be a place where there's not as much engagements going on. Bringing familiar items for comfort if the environment is familiar. Okay, so something as simple as a blanket that they use during the evening, on a long trip, for example, their favorite mug, their favorite clothes, for example. We all have that favorite pair of jeans. That this is that time. If you know what clothes are their favorite and you can go buy duplicates of those, please do, because that makes all the difference for them. They're going to want to wear the same clothes a lot of times day after day because of that cognitive decline, and this is a great opportunity for us to get them to help them be as comfortable as possible. Other pieces of the environment that might be unfamiliar, removing clutter, also reducing glare. This is kind of an unusual one that doesn't come up too often, but glare or reflections, right? So this could be off a car if you're doing a lot of driving around with somebody who's experiencing sundowning in the afternoon. Might not be the best time of day to do that. Even mirrors or a really shiny table makes a big difference for them. Just that processing those different lights coming at them can be very jarring for them. All right, let's go to the next slide here. So at the individual level, those predictable routines that I mentioned, right? That schedule for bedtime, waking, meals, for activities, trying to be flexible with this routine around that person's changing biorhythm, right? We have some residents who wake up at 6 and they want breakfast at 6. I would be nauseous if I ate breakfast at 6. I prefer, 9:30, 10, 11. I'm a little bit more of a sleep-in person, right? Especially on the weekends, right? But that's going to be my habit when I get older, right? So trying to take note as they're going through this and see what their natural rhythm is. If you're putting a plate in front of them and they're not hungry, just put it in the fridge and we can heat it up later. Those guaranteed times, right? The normal breakfast times might not be the same for them for a while. Limiting daytime napping is also a big one. So there was a recent UCSF, so UC San Francisco study. They actually found a correlation between napping for less than an hour a day is better for preventing a lot of sundowning or symptoms with dementia. Napping for more than an hour a day, sometimes it kind of like resets their clock again, right? They're waking up, they're asking what time breakfast is, right? I'm sure some of you are nodding on that one for sure, right? Asking for breakfast in the middle of the afternoon and trying to convince them dinner soon, but it's what's their quality of life. If they're hungry, getting them a snack is a pretty easy thing for us to do if that's what their body's telling them they need to do. Limiting caffeine and sugar to morning hours. That sugar crash is definitely real. More complex sugars and complex carbs, right, such as fruit or whole grains are a little bit easier for them, for their body to process. Chocolates, yes, we love them. They are very much, especially today, happy Valentine's Day to everybody. Chocolate is very much a comfort food, but it's not really great for that quick processing that the brain's trying to work as hard as it possibly can during memory decline. Limiting alcohol to reduce increased risk of confusion. This is a difficult one, I think, especially for individuals who are living on their own. You might have somebody like this in your life. That confusion, alcohol is a great option, right? It's pretty logical. It makes you feel more relaxed. Maybe it helps you with some sensory overload, and it could be, unfortunately, it could be a coping mechanism, and we see that quite a bit where dementia is aggravated or increased by alcohol. So that's a tough one. Those habits too, there's alcohol-free wine, there's alcohol-free beer. You can make a mocktail. Sometimes that habit that they've been in, it's just really the process of having that drink, right, without the alcohol. So you can kind of work around that sometimes for their benefit, but it's really helping their body to not have that level of alcohol for them. Looking for behavioral patterns to identify what makes their symptoms better or worse, right? So if you're going to do some behavior mapping, you might note which rooms they seem to go into more so, or where they tend to go or drive around to. They might be at the same supermarket every day at a certain time in the afternoon because that's very familiar for them. Okay, other distracting activities, right? So we want to redirect to their favorite activities, their favorite foods, clothes, animals, or people. It's okay to have silence. I'd like to make sure everybody understands that. If you're with somebody, sitting down and pulling up a funny cat video on YouTube and watching that for a half hour, or putting on a Gaithers concert or something, doing things in parallel is very, very beneficial for them. And our well-meaning concern, we want to ask them how they're doing. Are you hungry? Are you thirsty? Right? It's very nurturing of us to do that, but sometimes they just need to be able to be doing something in parallel, like taking a walk or maybe gardening in silence. Silence is totally okay. And oftentimes we try and reduce the silence with dementia, which doesn't really help a lot. Favorite activities like the garden. Sometimes people, especially grandkids, it's that one-off, right? It's not the child, it's not the adult children, it's the grandchild. They're not going to get mad at the grandchild. So sometimes bringing over a grandchild or two during those afternoon hours, it might work 9 out of 10 times, but a lot of times their response is going to be a lot lighter to them than it would be to somebody who they might see as affecting their level of independence, right? If we're older and our daughter's coming over and they're trying to take care of us and we were the mother, I'm sorry, we're still the mother in our head, right? So somebody who's experiencing that decline might be a little bit more resistant to some guidance or direction from adult children versus maybe a son-in-law or grandchildren in general. Pet therapy is huge. Silverado communities, we actually have one of our best practices, one of our standards is to have pets in the community. We have a ratio of dogs and cats to individuals, and this is huge, right? So even taking a drive by a dog park, or if you're in San Diego or Orange County, wherever by the beach, there's a lot of dog park beaches. Just being able to watch them at a park running around, that can really turn around somebody's day. Reducing visitors, like I said, anybody who's a little bit newer to their memory, right? Family is long-term. They've had those memories that have built on top of each other for many years, but visitors, or even other sounds from outside, right? So cutting the grass for them in the middle of the afternoon is very helpful, ideally, but that noise is really going to throw them off for sundowning as well. So anything that brings in comfort, that's what we're going to focus on during this time. Okay, so some of the treatment options for Sundowning syndrome. Of course, try non-medication interventions first, right? So that's sedating medications that have an effect in overnight that could increase decline. Not really recommended for a first-line approach. I know a lot of us, myself included, I will admit, are Google doctors, right? So we want to make sure we're reaching out to those, general physicians, neurologists, anybody who has that specialty in geriatrics to help us along with this and advise is really going to be important. We need that village to get through this. Light therapy, as I mentioned, exposure to fluorescent lights versus daylight, especially in the morning hours, is very helpful, right? Having breakfast near a window and having the blinds fully open. Or in our lovely 70-degree weather that we're having this week, it's a little cooler today, sitting out on the patio, right? Get a scarf and put a jacket on and have breakfast outside under your covered patio would also be great. Regulating the sleep cycle and adjust the sleep environment, right? So a lot of studies show it's better to have a cool, dark environment, right? So in those like mid to high 60s for temperature and lots of nice comfy covers. Aromatherapy, familiar and comforting smells, right? So peppermint, cinnamon, sometimes boiling a pot of apple cider. They might not drink it, but just having that comfort of something that's a very familiar, a holiday sense, you could put that throughout the entire year. Or, even an orange scented cider, for example, is very comforting. Physical activity, going for a walk can improve sleep at night. I don't recommend that necessarily during sundowning hours, but earlier in the daytime, that's going to help keep their body on that rhythm that we talked about. Music therapy, the years that we listen to music that are the most impactful for us are between the ages of 12 and 25. So we ask for that when families come in the community. We know what age our residents are, but we do ask specifically, did they like jazz or big bands or, there's a lot of different types of music, 70s, 60s. That's going to make a big difference. Those lyrics that they heard, at their first prom or at their wedding or, driving in their first car, those are really impactful and very comforting as well. That healing touch, right? If you're in a calm environment and just sitting down, just holding their hand, right? Or sometimes touching their back could be a little bit of a, that might be a little uncomfortable for them. So I always try and give them an open palm. Can I hold your hand? Would you hold my hand? My hands are cold. A lot of times that works, right? If they're providing some value or some help to us. Medication treatments, right? Of course, with your physician, checking with them to see if there's a medication that might help. Okay, this is the USC Light Study that we had mentioned earlier. So 2018, Dr. Kyle Konis, he's from the School of Architecture at USC, and Dr. Ed Schneider from the USC School of Gerontology. They had a randomized controlled trial that was run at 8 Silverado communities in the Los Angeles area. And I was the pilot graduate researcher on this. So I actually went into the communities. This was my first foray into senior living. I'd since been at the VA, and we did mini mental state exam cognitive tests for residents who scored 15 to 20 out of 30, so a little bit on the higher side. And we did also a Cornell scale of depression. So we did that before and after. So sitting them in a room with a particular amount of incoming daylight, they have these really cool sensors that can sense how much internal versus artificial, the daylight. So we would have a group of maybe 8 residents who ate breakfast every day for 4 months right by a window, right? And it had to have a certain amount of incoming daylight, right? The window's all the way open. And then we'd have another group, maybe they're just in the other side of the dining room, but they're not near a window and they have more of the artificial light that's coming at them. And so really the findings that were found was that increased exposure to daylight really does help reduce depression in people living with dementia. So that was really important. A lot of communities now are doing floor to ceiling windows, for example, in dining rooms. So how are we going to handle this once it occurs, right? In the moment, being calm, not raising our voice or touching them unexpectedly. Simple things that we do that are normal for us if we're quick moving, right? Coming up from behind them, putting our hand very lovingly on their back is going to be startling, right? So like I said, those open palms, how are you doing today? You know, giving them their space. Don't stand over them too. If they're sitting down and you're standing over them and trying to ask them a bunch of questions, that's going to be really stressful. So one of our best practices is training our care staff to get at their same eye level with them, whether it's kneeling down or sitting down next to them to talk very calmly. We don't want to restrain, disagreeing or belittling them. They're already in that heightened state. They can't talk themselves off the wall. Their brain is just not going to let them do that right now, right? That's not their fault. It's just the way their brain is processing information because it's being, you know, the neurons are being damaged. So we want to just try and support them if they're pacing, clear a path for them to walk back and forth, trying and avoid arguing or rationalizing, right? And the quote we kind of go to is that if you don't insist, they can't resist, right? So we might try and sit down. They might come and sit next to us, right? If they're going to walk around, try and reflect their facial expression as well. If somebody's coming up to me and I'm trying to make them feel better, right? Let's say they have an adult child who's 50, but they think they're 5 or 6 and they have to pick them up from school. If they're frowning and they're using all their hands, and maybe they're not as Italian as me, but if they're really stressed out and you can see that, giving them a smile and telling them, oh, it's going to be fine. Let's go have some ice cream, or like, why don't you come sit down? You're, you know, they're 50 years old. They're not at school. You don't have to pick them up. It's great. We can relax here. That is not going to be helpful. Anybody who's been a parent or overseeing somebody, not knowing where your child is that fight or flight response. That is a panic attack waiting to happen, right? So if they're sad, we're sad. If they're happy, we're happy. We want to help support them instead of trying to overlook what they're feeling. Okay, other helpful tips, turning on soothing music, validating their concerns, listening calmly to their confusion, and trying to discover the cause of their behavior, right? So offering their favorite foods, like we've mentioned, holding their pet or a book. A lot of older adults, not so much the millennial generations and down, are used to magazines and newspapers, right? So even if they've gotten to the point in their decline where they cannot process or read anymore, being able to have that dignity to do what they've been doing, again, what are their routines for their decades? Holding a newspaper. It doesn't matter if they're looking at the pictures. It doesn't matter if they're holding it upside down. That is something to them that feels normal, that they're able to present, and that could be really important for them. So trying to keep those going, right? A newspaper subscription, even if they can't read, could be a big deal for them to do with their coffee in the morning, for example, or right after lunch. Introducing new activities that might be a little bit repetitive, right? So maybe folding napkins, something that would help, right? Hey, can you sort these utensils back into the drawer? Or can you help me put these back here? Again, keeping that area well lit and closing the curtains. Once it occurs, right, we're going to make sure we're taking care of ourselves and try and adjust our approach. Our emotions are going to have a really big impact on this person who's experiencing their distress. So trying to take a few slow, deep breaths before approaching them, having a calm, gentle presence. Your slow, deep breaths could happen in a restroom. You might need to just go take a 5 and go in the restroom and try and calm yourself down. You know, look at a pic of your dog or your cat at home to get us a little pet therapy and then go back out. That's okay. We need to take those times for us too, so that we can offer it to them. Talking very fast is going to be also very difficult for them to process. So slowing down, giving them enough time to respond. It could take a half a minute, right? If they're looking at you, and a lot of times when somebody's thinking, They either look up to the left or they look up to the right. So if they're staring at you, they're probably not comprehending, but if they're looking up, they're probably still processing. So try and take that maybe as a cue to wait a little bit longer, and they might be able to respond. Finding little ways to de-stress, right, throughout the day. Our stress is going to heighten as well. It's okay for us to say that I'm tired, right? I try and encourage everybody, you got to use the I am whatever you are. I am upset. I am anxious. I am tired. I'm going to sit down, right? That's okay. It's okay to ask for help, right? If somebody was in our situation, if we are a caregiver, we would want somebody to do that for us as well, and we would want to help somebody else through that. That communication, that body language and tone are really important. All right, so real quickly through these environmental adaptations. So if in senior care or hospitals, minimizing those activities during shift changes, reducing noise. We've kind of mentioned quite a few of these. Providing familiar belongings or music, right? If they are going to take a rest or on the overnight, white noise machines are phenomenally helpful, right, to reduce noise and provide that background consistency that's going to help them sleep rather than listening to the AC come on or somebody walking down the hall. So Dr. Al Power, who wrote Dementia Beyond Disease, had this quote. So a senior community has all but eliminated so-called Sundowning Syndrome for over a decade by putting an end to the late day commotion. They instituted a policy of rest as needed that listens to the individual's rhythm rather than an artificial schedule of rest and activity. And so this is what is really important for us to do if we're supporting seniors at a community. It's not a one size fits all. Not everybody fits into the same quote unquote box of a routine. And so being able to train to that is really impactful. Entering their reality, right? We call this therapeutic retelling. Not disagreeing with their view of the world, right? They could relive the past. They're thinking their kids are younger, like at that example I mentioned, but their kids could be older adults, right? What's the logical thing if they're trying to find their kids and you know they're never going to find their kids because they're not 6 and 7 would be, oh, it's Saturday, they're probably outside playing, or maybe it's summer and they're off school, or dad's picking them up, right? So whatever the logical progression is that would give you some validation and give you a sigh of relief, that's what we want to do for them as well. Assuring individuals' needs are met, right? So structured activities during the difficult time of day. Make sure they're wearing those devices, hearing aids, glasses, ensuring that they're hydrated and well fed. They might not sit down all the time, so it's okay to go with them or let them browse around. Things are going to get lost, and that's okay too. And we just want to make sure we're trying to keep their most valuable items with them, right? Like a purse. Losing a purse when they're sundowning is just going to aggravate everything even further. Okay, trying to avoid those medications that cause confusion as well. All right, so some additional resources you can review. UCI Mind, which is an ADRC across the country, Alzheimer's Disease Research Center, their website's here. We also do have a number of support groups at our community and across our company for Silverado. So please just reach out if you'd like to inquire about those. Of course, Alzheimer's Orange County has a wonderful group of resources as well for support groups. And our website is located here if you have any other questions. And it's been a pleasure to spend some time with you today.
Okay, so I think you covered that topic from A to Z, Erin. That was just so great. Thank you so much for being with us today. And we do have a few questions, but I'm just looking at the time, so it looks like we're going to run over a little bit. If people have to leave right at this time, they can, but we encourage you to stay for the Q&A. So before we begin that, a couple things. One is with respect to all of the topics we cover, we always ask to have everyone remind themselves of the importance of being aware of implicit biases, or what could also be known as unconscious stereotypes, as we care for others. A best practice is a person-centered approach where we view each person that we care for as an individual with unique needs and preferences. And we treat them with dignity and respect, even when they're very different from ourselves. If we always listen carefully and respectfully so that we understand their perspectives, their values, their culture, their preferences, we can build trust and provide the highest quality of care. Okay. And then also, I want to just take a minute to thank our sponsors once again that generously support all of these topics of such great interest to the senior community and the dementia community, whether you're a family caregiver or professional. So that's O'Connor Mortuary, Care Choices, Hospice and Palliative Services, Caring Companions at Home, and Alzheimer's Orange County. Also save the date for our next webinar. It is on Tuesday, March 14th. The topic is understanding and caring for individuals with Down syndrome and Alzheimer's disease. That'll cover a little bit of the other intellectual and developmental disabilities as well. And I will be the speaker for that. And so with that, let me just open up the question box and see what we have for you today, Miss Erin. Okay. Can sundowning occur early in the morning, or is it not sundowning if it doesn't? In other words, if it doesn't happen in the afternoon, do we call it something else if it happens in the morning? What is it?
It could still be sundowning. I would say if there's a consistent time of day where very similar uncomfortableness or anxiety is presenting, between 8 and 10 in the morning or 4 to 6 at night, it's mostly late evening, but it would still be considered sundowning at that time if it's that consistent. And that could be med related or some of the other things that we mentioned as well.
Great, thank you. Is it still considered sundowning if the person had cognitive and behavioral changes in the evening, but not mood changes such as aggression or anxiety?
Absolutely. Sundowning doesn't have to include everything at once. A lot of times it is pretty predominantly anxiety leads to agitation, leads to paranoia, everything. So a lot of times it will escalate, but it doesn't have to be. It could be very subtle. It could be, like they said, from a UTI, for example. So they could just be a little less talkative or, just walking around a little bit more. It doesn't have to be as blatant. So sometimes it's hard to catch.
Thank you, Erin. Not a question, but a suggestion. One of our viewers said that they used a life-size baby doll that cooed, giggled, and sucked on a pacifier for our mother to hold. It calmed her extensively. So that's nice to hear. When my mother has anxiety at night, should we leave a night light on all night? What is the ideal sleeping environment?
Yeah, I would say try and figure out what she's doing at night. If she's up and down, night lights, yes, please. If you're able to leave on a bathroom light, maybe with it cracked, whatever's going to help them reduce any risk of tripping or falling, just for them to be able to see their surroundings is going to make a big difference. You can even do lights that have the sensor motion detection. Sometimes that helps if it's down the hallway. That might pick up something as well.
Great. Is it just white noise that helps? I heard recently about brown noise and green noise.
Oh, sure. Brown noise, green noise. If you're, maybe if you're from the wetter parts of the country, maybe rainfall is great too. White noise machines in general normally have multiple settings that you can use. Just making sure it's not too loud and, not too soft. It's that fun balance we got to find.
Okay, one more question. Can you clarify the current stance on naps? I've heard that it resets the brain in terms of rest, not just the time of day, but it supports or prevents certain levels of sundowning. So napping as a treatment for sundowning. What do you think?
It definitely does help, but like we shared with some of the studies, it's a little bit it's less risky if it's in shorter periods of time. So if you think about, I'm not going to go into REM sleep, but it takes a little while for your body to get into that deep sleep, and that's kind of around that 45-minute to an hour mark that they're talking about. So that could be why it's resetting. I'm not sure. I'm not going to speculate, but shorter cat naps are going to be great. If they've had a really rough night and they need to sleep, please let them sleep, because that could really affect it too. So.
Let's take one more question because it's cropped up a couple of times now. What exactly do you mean by doing things in parallel?
Sure. Great question. Doing things in parallel would be not as engaging, right? So instead of sitting across from somebody and trying to do flashcards or trying to engage with them immediately, some examples would be watching a movie together, going for a walk. So something that you're both being able to be a group on, right? So similar to when we say, we try and train our caregivers, for example, to say, let's go to the restroom before lunch, instead of saying, it's time for you to go to the restroom before lunch. We want to make it more inclusive. And so that could be, if paint, watercolor paints, for example, maybe cooking, folding laundry. So that's kind of more of the, doesn't necessarily have to involve communication. Hopefully that makes sense.
Thank you, Erin. Well, that does bring us to the conclusion of our webinar, and we thank you, Erin, so much for this very valuable presentation and for your time, because we know it's limited, and your expertise. So everyone, as we get ready to end the webinar, please watch for the survey that will, as I indicated, open up immediately on your screen. And will also be emailed to everyone within an hour after the webinar ends. See you next month. And also, by the way, if you did not get your question answered, we have the helpline number up here on the screen. Please feel free to consult with our helpline. They're very well versed in sundowning and other behavioral expressions. So, okay, so thank you everyone for joining us. I look forward to seeing you next month, and have a really great day. Bye-bye.